Okay, guys, I'm planning on this being the last video, so hopefully it won't last too long, but try and getting it all through with and everything. Last one on the senses. Okay, so we talked about last time about the way that we form an image, and those are the four ways. But we also have to have stimulation of the photoreceptor cells. Remember, those are the rods and those are the cones. And what they actually do is they have a chemical change whenever light is absorbed. It changes the structure. So rods are what we see gray with, so that is rhodopsin. In the rods are rhodopsins, and when light hits them, the opsin, which is the protein, and the retinol, vitamin A, then reforms. So it's a chemical signal or a chemical change that actually stimulates the receptor cells to send a nerve impulse to the brain. When we talk about night blindness, oh, this is an interesting aside too. Like vitamin A, Bugs Bunny's always eating the carrots and he's supposed to have good eyesight. Now, you probably don't know who Bugs Bunny is, but he was a famous cartoon character back in the day. And so, yes, vitamin A is in carrots and good. Retinol itself is a lot of times even good for skin and everything like that. So, it's good to get your vitamin A. If you are deficient in vitamin A, then what you have sometimes is called night blindness. That's a lack of the photopigment, and you can't see well in the dark because the rods are not stimulated, and the cones don't work very good in the dark. So, and you got to remember where light hits them too. So, let's talk about the cones for a second and we'll go back to that. Okay, in the cones, they actually have three different colors. They contain retinol, but the different proteins. And the colors that you actually see are red and green and blue. Each cone has its own color, like the one cone will be red, the other one green, the other one blue. Whenever light hits the different ones, that's what makes us see different colors. It's just like mixing paint. Okay. Color blindness is when you're missing one of those cone photopigments. The most common is red-green, and they can't tell red from green. If y'all did the lab, there's actually a colorblind sheet that you can look at to see what type of color blindness you have. But if we go back to this picture right here, that shows the cones right here. That's with the green right there, and those are the cones, and these are the rods, the longer ones. Okay, if you go back and you remember where the rods are, remember they're on the periphery of the eye, right here, whereas the cones are concentrated back in here, and there's only cones right back here. Now, remember, if your eye is dilated, then you can see at night, okay? More light is coming in. And then the rays of light will hit the cones, therefore we see grades of shades of gray. Whenever the light comes directly in and our pupil is constricted, the light will hit the macula lutea where there's only cones, and we'll see vivid colors. So actually the cones go back here toward the back, but they get fewer and fewer until there's none in the macula lutea, the fava centralis. And the cones, as they go up toward the front of the eye, get fewer and fewer. So if you've ever noticed when the lights are off and you can't see color very well because you're seeing shades of gray. And then whenever you have bright light, you're able to tell the different colors from each other. Okay, so, sorry, got confused there where I was going. So we know what night blindness is and color blindness. Let's go ahead and talk about the visual pathway. It goes back to this PowerPoint. Oh, right here, okay? So as light comes in, remember it travels a different density and it comes in the back of the retina flipped over and upside down. Then it travels down the optic nerve, okay? And then it crosses the optic chiasm right here. You can see the nerves kind of splinter off at that point. Then from the optic chiasm into the optic tracts, it enters the brain at the thalamus. And from the thalamus, it goes to the occipital lobe. Let's look at our word again. Sorry. I'm doing a wonderful job with this. Okay. So the photoreceptor cells are stimulated, and then the bipolar cells and the ganglion cells. So it actually goes backwards, which is pretty interesting. Let's go back to this cell. So here are the photoreceptor cells. They're stimulated. It goes back and it is absorbed. All the stray light is absorbed by the pigmented layer. And then the transfer of the impulse is actually going from the cones and the rods, the photoreceptor cells, to the bipolar cells, to the ganglion cells, and then that is what travels to the nerve. So it goes to the optic nerve, the optic chiasm. Like I said, if you look at the flip side of a brain, you can see it's on the bottom of the brain, or the inferior aspect. And then the optic tract goes into the thalamus, and then the occipital lobe, where we actually process the vision. Okay, let's talk about the common disorders real quick. We have cataracts. Whenever we talk about cataracts, the lens becomes cloudy and the protein actually changes. Cataracts can be caused by UV exposure, not wearing your sunglasses. They can also be caused by injury, smoking. Sometimes people that undergo chemotherapy and will have cataracts from the treatment. The risk increases with smokers, and you just replace it with an artificial lens. If you look at this picture right here, this is talking about the eyesight, myopia and hyperopia and everything. So you can look at those if you want to. I did put these on Plus Portal. This is cataracts right here. So you can see the lens clouds up because of the damage to the protein. It has to be removed. So all they do is they go in, take a cut into the bottom of the cornea, and then pop that lens out and then put in an artificial one. So that's a pretty easy fix. Then let's go on to the next one, glaucoma. Glaucoma is a buildup of aqueous humor, and remember that's in the anterior cavity, and that whenever the fluid builds up in the anterior cavity, it puts pressure on the retina and the optic nerve. Actually, what happens is the optic nerve gets real big, the retina is damaged, but it is totally painless. So what happens is the damage is done before you're actually diagnosed, and then there's nothing you can do about it. So it's really important to get your pressure of your eyes checked. This is glaucoma, and this is kind of what you see. You start to lose your peripheral vision as it builds up and the pressure increases in the eye itself. It can be corrected with surgery and with meds also. So again, be sure y'all get your pressures checked in your eyes when you go to the doctor. The next one, where is it? Sorry. Okay, the next one is age-related macular disease. It increases with smoker because of the damage done, and it's degenerative disorder of the retina itself and the pigmented layer behind it. The people keep the peripheral vision, but they can't see what's straight ahead of them. So the actual where they can't see is in the middle of what their vision would be. But their peripheral vision, they can see images and everything. Sometimes they have some good commercials and some examples of that. I do not think I have an example of that. Okay. Then these last two are with the ears. Meniere's disease is increased endolength, and that makes the membranous labyrinth really large. You have fluctuating hearing loss. You have tinnitus. A lot of people have vertigo with this. Like they find it really hard to keep their balance. Like if they're sitting in a car, they might think they're moving when really the car next to them are moving. It can eventually lead to deafness, but the imbalance and the vertigo are pretty debilitating sometimes. The last one is otitis media, which literally means infection of the middle ear. It's an acute infection of the ear, and you may have had it when you were little. A lot of times that happens. And you have pain and fever. Sometimes you can get a ruptured eardrum. What happens is, remember that auditory tube that is connected to the nasopharynx area and goes up to the middle ear, gets bacteria in it, and then it gets an infection in that middle ear and creates pressure. So a lot of times what they do is put tubes in the ear, and then the drainage can go out of the middle ear into the external ear. And the tubes are allow the pus to come out. Let's look at a picture of that. That's really all the notes. And oh, where is it? It's up here. Sorry. It's this one. Remember, this is an added on PowerPoint. They are on, and I put them on because I thought they were really interesting. Okay, this is a normal eardrum. You know, whenever they're shining the light down your ear, this is what they see. That is actually the malleus right there. Then what they do is, this is infected. You can see that's pretty gnarly with all the inflammation and the vascular tissue, very inflamed. Here is where they've gone in and they've put in a tube, very, very small tube. And then that allows the pus to drain out so that it doesn't create the pressure, and it allows the infection to move out of the ear. If you look back here, just do real briefly, we'll talk about a detached retina since the slide is right here. Remember, if your vitreous humor goes out or it shrinks, sometimes this does happen with age, then what happens is the retina starts to separate from that layer on the inside. Remember, it's the innermost layer. And you get flashes of light, showers of black dots. It's like, it's really strange. I had a retina pull once, and it was like I was seeing flashes of light, and I thought everybody was seeing the flashes of light. But no, not everybody was. It was just me. So a lot of times you'll see persistent shadows. It's like a shade has been pulled down in your eye. If you get to the before a tear actually happens here, then a lot of times they can repair it with surgery. And that's all it is for the eyes and the ears, guys. Like I said, don't forget that other add-in is there. You've got your PowerPoint and everything, and you got everything online you need to study, I think. Y'all have a great day. I've enjoyed doing these kind of, sort of. See you guys later. Looking forward to being back.